Dentistry is global, but practice is not. Hi, my name is Norma. I'm a Nigerian trained dental therapist and I currently practice in UK as a dental therapist, dental hygienist, and a dental nurse. On this channel, I will be talking about international dental careers, evidence-based oral health, and what it really means to practice confidently in a different system. Whether you're a dental professional thinking about relocating from Nigeria as a dental therapist, or a student trying to understand your option, or someone who simply wants clarity, you're in the right place. Today, I want to share my journey honestly and transparently with you. My journey started in Nigeria. That's where I trained. That's where I built my clinical foundation. That's where I first understood what it meant to sit behind the dental chair and take responsibility for someone's health. Training in Nigeria shaped me in ways I'm deeply grateful for. It taught me discipline, it taught me adaptability, it taught me how to work in environments that sometimes require resourcefulness and resilience. And most importantly, it gave me confidence in my clinical ability. But what I didn't fully understand at the time was this: clinical training prepares you to treat patients, but it does not magically prepare you to navigate a completely different healthcare system. That's where the transition began. When I transitioned to practicing in the UK under the regulation of the General Dental Council, I quickly realized something important. Being clinically competent is one thing, understanding a governance, compliance, documentation, patient expectations, and regulatory culture is another thing entirely. And these where many international professionals struggle, not because they lack intelligence or skills, but because the systems are structured differently. And unless someone explains that difference clearly, the adjustment can feel overwhelming. Let's talk practically what's different. What changed? First of all, documentation. In the UK, record keeping is extremely detailed and structured. Every note matters, every decision must be justified clearly and professionally. Secondly, is infection control protocols. The standards are strict, standardized, and consistently audited. You're not just performing procedures, you're practicing within a framework of accountability. Thirdly, scope of practice clarity. Here in UK, your role as a dental therapist or hygienist is clearly defined and regulated. Understanding exactly what you can and cannot do is crucial. The fourth one is the patient expectations. Communication is different. Consent conversations are different. Patients often ask more questions. There is a strong culture of patient autonomy and documentation of shared decision making. None of these differences mean one system is better, don't get me wrong, but they do mean you must adapt. And adaptation requires humility. What people rarely talk about is emotional shift. Moving from one country to another as a healthcare professional can challenge your confidence. You might go from feeling fully competent to feeling like you're relearning how to practice. There were moments I had to pause and remind myself my training is valid, my knowledge is real. I just need to understand this system And that mindset shift is powerful, believe me, because once you understand the system, your confidence returns, but stronger and more refined. Here are a few things this journey taught me. One, your my training is valuable, likewise yours, but the system matters. Preparation reduces anxiety. Communication skills are just as important as clinical skills. Professional growth never stops. Relocating as a dental professional is not just about passing exams or registering, it's about understanding the culture of care. And once you understand that, you don't just survive, you thrive. I started this channel because I realized something during my transition. There are many international dental professionals who are capable but lack clear guidance. There are also people that are looking to relocate from Nigeria as a dental therapist but don't really know how to go about it. So I decided to create this space. On this channel, I'll be sharing real insights about practicing as a dental therapist internationally, my General Dental Council registration experience, guidance for professionals that are navigating relocation, evidence-based oral health education explained simply, honest conversations about confidence and growth in dentistry. This isn't surface level dental talk, it's clarity, structure, and confidence beyond the chair. If you're watching this channel and you're considering practicing in UK as a dental therapist from Nigeria, I want to say this to you: it is possible, but don't underestimate preparation. Understand the system, respect the regulations, strengthen your communication skills, and trust your training. Growth is uncomfortable, but it is also transformative. If this channel resonates with you, I would love you to subscribe and join this journey. In my next video, I'll be sharing my General Dental Council registration journey in detail and breaking down what a dental therapist actually does in the UK, because many people have been comparing the both and wondering exactly how it is. Thank you for being here. I'll see you in the next one. Bye for now.